The patient is 37 years old with a history of one caesarean section 7 years ago. At the time of treatment, the gestational age is 7 weeks 6 days. The size of the fetus and ovum corresponds to 6 weeks 3 days. Heartbeat is not detected. Beta human chorionic gonadotropin level 10,192. Transvaginal ultrasound, the endometrium is thickened. There is no fertilized egg in the uterine cavity. In the area of the scar on the uterus with the transition to the internal os and upper third of the cervical canal, a fertilized egg is detected. Vascularization around is greatly enhanced. The thickness in area of the scar to the bladder wall is 7 millimeters. Embolization of the uterine arteries was performed with the introduction of intra-arterial methotrexate, 25 milligrams on each side. You can see pronounced vascularization before and absence after the procedure. 10 days after embolization, beta-chorionic gonadotropin was at the level of 1009. 16 days after the procedure, the gestational sacs decreased by 1.5 times. There was no active blood supply on Doppler, but there was no expulsion of the gestational sac. It was decided to perform hysteroscopic removal of the remaining fetal tissue. Diagnostic hysteroscopy was performed under visual control by vaginoscopy. The uterine cavity is empty. In the area of the scar with attachment more along the right side wall, decidual tissue with blood clots is detected. After this, it was decided to remove the fertilized egg using a thick broom of a plasma kinetic bipolar. The task was to push the remaining fetal tissue towards the uterine cavity, cauterizing areas of bleeding, followed by removal entirely from the uterine cavity, after which some areas that were tightly attached to the wall in the scar area were cut off. With a decrease in fluid pressure in the uterine cavity, areas of bleeding were identified that were successfully coagulated. Blood loss during the operation was no more than 20-30 milliliters. The patient was sent home a few hours later. 7 days after procedure, the level of beta-chorionic gonadotropin was at 11. This was our 16th patient in the last 12 years with the uterine scar pregnancy who underwent uterine artery embolization using intra-arterial methotrexate. Self-expulsion occurred in 12 cases. In 3 cases, aspiration was performed under ultrasound control. This was the first case of removal of fertilized egg under hysteroscopy. We have one case of birth of healthy child after embolization and several pregnancies with normal localization in the uterine cavity, which were interrupted at the request of the patient. Thank you for attention.